The world has experienced disasters that have resulted in many casualties. At these times, our thoughts were primarily with the victims. Agony and pain were the most common feelings, wondering what's going on down there with them. Do they have doctors beside them, and what about ambulances? Are there any drugs, and what happens to persons with disabilities? Not to mention the anxiety with our most vulnerable children. And many such things. The last time fires broke out in Greece, they caused a great number of deaths, injuries, and homeless people. Many were to blame for having arrived at this point, but it is certain that the high density of the population, combined with the problems of roads, greatly increased the risk of catastrophe. Roads, electricity, water, phone lines, cables, all communications with the outside world were destroyed, and of course utilities disappeared. Parts of the social and functional fabric as a whole were destroyed. Assistance would certainly be needed immediately, but the relatively remote to disturbed area would create problems in the arrival of external aid. This is something that would force officials to find ways to meet their needs with their own resources for some time. Victims would require medical treatment, and many would start to suspect public health risks. Their needs should be assessed, and, of course, the resources needed to prevent adverse reactions should be identified and requested. They will begin to implement appropriate public health strategies, such as outcomes and response to potential outbreaks. Evaluation of the effectiveness of relief measures and improved treatment plans for impending illnesses is implemented. The morbidity and mortality patterns of some diseases would sufficiently assist these health workers. But in those moments much played a lot and had a crucial importance for an effective emergency medical intervention. All actions depended on the health services preparedness. Knowing in advance what medical problems will be treated, and of course the possible symptoms to appear in the affected individuals, is a key in an effective response. Once this demand was met, the potential for an appropriate invasive treatment and rescue strategy, supplies, equipment, and personnel, was welcomed. However, experts know that overcrowding and poor water supply, along with poor sanitation and hygiene, are known factors that increase the incidence of diarrhea, respiratory infections, and communicable diseases. At the same time, numerous therapeutic measures, first aid, mostly early, would be applied during these hours. But none of them would be able to compensate for the devastating effects of a problematic environmental health planning. This is why a good water supply and waste disposal system should be established rapidly. How important it is to demand immediate health checks on the operation of water and sanitation systems. All efforts should be directed towards safeguarding environmental health. Access to adequate sources of drinking water and the collection, disposal, and treatment of feces and other liquid and solid waste were necessary. Some officials allegedly realized that several wastewater and waste disposal facilities needed to be put into service. Toilets or defecation units, solid waste collection points, and water distribution points should start operating immediately. But what precisely did they do? At the beginning of the acute phase of the catastrophic fire in Greece, Matti, certain precautionary measures should have been taken. If the construction of the toilets had not started, they would at least have taken basic drainage measures that would be nothing more than a simple identification of a specific area for defecation. We believe that immediate preventive measures have been taken because there is a strong likelihood of malfunction. Causing mechanical damage to the water system and introducing foreign material into it is highly probable. For example, the presence of different particles, soils, mud, etc., should be a major concern. At the points in the system where defects were found, a detailed medically connected identification and a study of the causes of the problem would be carried out immediately. After the necessary repairs, hyperchlorization similar procedures will be performed with a high concentration of chlorine solution and a corresponding residence time, according to the instructions of the World Health Organization. And finally, they would pay attention, but with less intensity, to the personal cleanliness of the victims. Maintenance of cleaning facilities, laundries, should also exist, with an adequate supply of soaps wherever possible. To a lesser degree, authorities adjacent to the affected area would begin to provide enough relatively clean water. It is preferable to provide small quantities of high-quality water, with an estimated consumption of 15 to 20 liters of potable water per person per day. It is important to remember that controlling disease carriers, such as mosquitoes, flies, rats and fleas, is an important part of an environmental approach to health intervention. However, these actions should begin immediately. But all this in terms of good disaster management requires a precise and rapid arrival information for the assistance in fires. But was such a thing possible?